I'm delighted to be asked to chair this session. For me, this is an incredibly important area of work for all of us. And there isn't one of us on the call today, I'm sure, cannot say that in their professional working life that they're not challenged by trying to motivate and engage adolescents and their families living with type 1 diabetes. This for me is the most challenging area of my work for sure. And I'm really delighted that we've got this topic on our teaching seminars that are being supported by Abbott and very ably managed by the team at SBK. So it's very nice for me to be working with them again. So I don't want to take up any time rambling. I'm going to hand you over to my very good colleague, Professor Deborah Christie. She is a professor of pediatric and adolescent psychology and a clinical psychologist working with her team that are very well known down at University College London. So with pleasure, Deborah, you and I are working together for the next hour for you to tell us how we can possibly motivate this really challenging group of individuals. Thank you so much for your time this afternoon.
Thank you very much. It's a pleasure to be here. I have to say, it's never the same sitting in my loft as I am today and speaking to an empty screen. I know you're all out there and I'm really looking forward to having a chance to talk with you a little bit about this idea of how do we motivate. So let's start off with a little bit of a poll. Let's check out on a scale of 1 to 10, thinking about how confident you are to be able to do these 4 learning objectives. These are our 4 learning objectives for today. And we've got a poll to start with. So hopefully, if all the tech works, there we are, it does. So have a read through the first objective. And on a scale of 1 to 10, with 1 not being confident at all, and 10 being incredibly confident, how confident are you that you know how to overcome barriers for maintaining contact with patients and their families? So if everybody could start voting and clicking. I can't vote. Well, hopefully I'm confident already, but if you could already click on that. And then when you've clicked on that one, you can scroll down to the next one. And again, it's the same question. How confident are you that you know how to apply motivational interview skills and interventions to remote and face-to-face consultations? Again, can you click on that? So everybody's had a chance to click on there. And how confident are you that you know how to empower adolescent patients to understand and act on their data? Okay. And then the last objective is, how confident are you that you understand ways to utilize peer support services and consider the impact on engagement? So everybody should have had a chance to do that. And at some point, I'm hoping that we're going to see results for each of those 4 learning objectives. Now, nothing is happening. Oh, here we go. Right. So, overcoming barriers. You can see people's confidence levels. Applying motivational skills, empowering adolescent patients. So there's it's around like most people are around about 4, 5 or 6. And I was going to say anybody that answered 10 to any of those questions, I was just going to suggest you carried on reading your emails and just turned the sound off. But that's great. And so what I'd like to do now is say, let me ask you another question. We're not going to do a poll for this one. What we're going to do is we're just going to, sorry, I'm just going to close that one, is now think about, well, how important is it to you that you do it? So if you want to do, you could put your answer in the chat here, just to get an idea of how important it is to people that they acquire these skills. And my third question is, how much of a priority is it that you acquire these skills. And those three questions, those underpin the basis of the motivational triad. Being motivated to do something, it has to be important to you. It has to be a priority, and you have to have the confidence that you could put it into practice. And we often talk about young people as being motivated or not being motivated, but it's not as simple as that. It's not a sort of single yes or no answer, because motivation involves this triad. And so it's always really important to remember when we're talking with young people that we ask them, well, how important is it for you to do this? How much of a priority, and how confident are you? Now, I recently discovered the joys of bringing along and working with young people. And so I've brought somebody with me today. This is Stephanie. And Stephanie is 15 years old. And what she says is, excuse me, what she says is being 15 years old means I should be able to be independent and have fun with my friends. In school, I want to be the same as everyone else. I was diagnosed with diabetes 3 years ago, and nobody really knows. I have some friends who know that I need to do some things to look after diabetes, but they can be really annoying when they ask too many questions. And my parents keep asking me, when am I going to sort myself out and look after my diabetes? People tell me, why haven't you taken your insulin or done your blood sugar? Can you eat that? Won't it make you sick? The nurses and the doctors say things like, we have support groups and counselling services. You need to see a psychologist, but you don't ever go. So why am I talking to you today? Well, I don't want to think about having diabetes, and I do feel pretty good right now. I don't have time for appointments because I'm studying hard to get good GCSE grades so I can go on to sixth form college. I really, really want to be a nurse after I leave school. So how motivated is Stephanie to change? Let's think a little bit about how to overcome the barriers for maintaining contact with patients and their families. How can we help them ensure that diabetes care stays a priority when there are so many other things that matter to young people? Well, the most important barriers when you're working as a psychologist are the barriers around beliefs. You guys know the facts, but young people have beliefs. And a lot of the time, the beliefs that they have are against change. They're actually beliefs that are in favor of not changing. So this first belief is actually an intention to not change. I'm not going to inject myself when I'm with my friends. And then there are disadvantages of changing. My friends will think I'm a loser. Why would my friends want to hang around with me? And then there's pessimism. It doesn't matter. I've tried before. None of the psychobabble the counsellor told me helped. I get a lot of that. Now, you see, this is what I hate about webinars, because if I'd been standing in front of you, you'd all have laughed at that point. So if I do a joke or something like that, maybe you could put chuckle in the chat, just so I know that the joke landed. Just an idea. So what about this change then? What are other beliefs? Well, there's negative comments, and you might hear them. I mean, how familiar are these? You will never understand what it's like for me. I mean, that's what most teenagers say to us as parents. But certainly a teenager living with diabetes certainly believes that nobody understands. And why do they need to come to clinic? I don't need to come here. They might also show you their disinterest in your helpfulness by not replying to your emails, by not coming to appointments, by not answering the phone, by being silent in meetings, by going, or duh. And I don't know if you caught me, I rolled my eyes there. They might check their phones. How many of you have had a conversation or a consultation with a young person who has just not answered their phones or just been on their phone texting? So let's see if we could warm things up a little bit. Tell me what other barriers you come across. Let's just take a couple of minutes to look at some comments in the chat or some questions about barriers. And Fiona, I think you're going to kind of read these out. Certainly the questions, people can see the chat.
Yeah, thank you, Deborah. I've been monitoring the chat, as you know, I would like to do. And I just firstly, very enthusiastic response to the importance of, trying to engage people. Anything that can help support the patients is vital. So everyone seems to be very enthusiastic. We've got 172 participants today, Deborah, so that's fantastic. So hopefully together we can generate some discussion. So comments that parents sometimes do make quite negative comments towards their young people. We certainly get that quite a lot, don't we? That the parents are maybe not as supportive to young people's attitudes and beliefs as we might like them to be. Would you agree with that? What do you think about our parents?
Yeah, I think it's really important that when we're thinking about motivational interviewing, that we're including the parents as part of the process. And we're going to be talking about that. So that's great. So that's really good that people have highlighted that, and we will be talking about that. So watch this space. That's good.
Yeah, and just a sort of people really feeling that the parents want their views heard, but don't take enough time to really consider the views of the young person. Yeah, which again is we are here for them, but we really have to take the young person views into consideration, or they won't engage at all because they won't think we're interested. I think that's another comment about, wonder what you thought about parental expectation being very high, and so young people always feel a failure. Do you think that's something we need to look out for?
I think that's a really good point, and I think that's true of everything. It's not just about diabetes. So I will share. I will do a bit of self-disclosure here. I remember when my teenage son, he's not a teenager anymore, he's now the father of 4. So, but he was a teenager. And I remember a parents' evening where he got a rotten report. And we came back from the open evening feeling very disheartened, and opened the conversation with, what on earth's going on? Your teachers say you're not interested and you're not working very well. And he said, I said, I said to him, all I really care about is that you're trying. It doesn't matter what results you get. I just care about what you're trying. And he looked at me and said, that's not true. He said, Mum, he said, you only want me to get A+. Now, I thought about when he said it, it really shook me, because I thought that I was trying to communicate that what mattered was effort. But actually kids do know that you want them to get good results, and it's good diabetes results, good HbA1cs. And you might say to them, all I care about is that you try. But sometimes there is that sort of subliminal thing. And kids, even if you don't feel that you're communicating that, that's what the kids are kind of double guessing. There's a bit of double think going on. They think that's what you think. So it's about how you manage that. And in the end, I suppose you say, well, yeah, of course I want you to get good results, but I also think that what matters the most is that you try, and that I help you try.
Yeah. So some of our audience too are worried that over the COVID pandemic, actually, Deborah, that we've lost a little bit of one-to-one connection with some of our families and our young people. And obviously, if you don't have good relationships with them professionally, then our ability to try and help them see life differently can be challenged. Do you think that's been a real contribution to our work recently?
I think COVID has a massive impact. And again, I want to take this outside of the diabetes arena. And we know that there's been a significant increase in emotional distress across all adolescents. And one of the things about diabetes, I always think that diabetes is part of adolescence. It's part of that growing up process. And having diabetes really trips you up as an adolescent. It stops you achieving all your adolescent goals. And COVID has done this even more. So it's a double whammy. So it's not a surprise that young people are struggling more generally, but then if you add in the demands and the burden of living with a chronic illness like diabetes, it's going to be much more difficult. Yeah. Which is why we all need to get ourselves up to speed with the tech, because Zoom is here to stay, and online groups are here to stay, and actually for many it's been really helpful, because it does mean you don't have to travel. For us at UCLH, for example, it means kids don't have to travel for 2 hours to come to a 20-minute appointment with a doctor, and take out a whole afternoon of school. And as psychologists, we've introduced lots of online groups so young people can connect across much better, and we're connecting kids more than we ever did. Rather than all sitting in a waiting room and not looking at each other because you're on the phone, we are bringing together communities of young people to share their thoughts and feelings about living with chronic illness.
Which is really, very positive. And I think also people are mentioning that we have to take into consideration different cultural differences as well. And for us professionally, it's the inequalities agenda, making everybody as important as each other is obviously coming through. So I think I'll stop at this point, Deborah, and I'll try and draw in all the comments, but I'll let you get on to the next part of your discussion with us. Yeah.
Okay, great. Thank you very much. Thank you for all those fantastic comments. Yes, and they're all, I was reading through the chat. They're really, really important. So we're going to do something now, which is we're going to do a 2-day workshop in approximately 40 minutes. And thank you for those of you that are putting smileys in the chat, so that I know that there are still people out there still listening. Let me begin by saying that motivational working in a motivational frame requires spirit. And spirit is like the music to a song. If you imagine, you can learn all the techniques, you can learn all the tricks and the techniques, but if you don't have spirit, then it's just like saying the words of a song. And when I was doing this, I kept thinking of songs, and I'm not going, I'm not going to sing. But if you think to yourself, what's your favorite song? I just called to let you know I was thinking of you. It doesn't sound the same if there isn't that music behind it. So. And we haven't got time to teach you how to do motivational interviewing, but if this inspires you and makes you want to have some of that spirit, sometimes just the spirit in itself can make a difference. So let's think about what we mean by spirit. And spirit is about 4 things. PACE is the acronym to help you remember. So you have to partnership. You're working in partnership with a young person. Acceptance, there's 4 bits of acceptance. Now, the absolute worth is that you respect the worth of every person because they're human. You find strength and value in where they are right now, rather than where you think they should be or could be. You have to remember that it's their choice and personal right to self-governance and care. They have autonomy, and you have to respect that. You have to put yourself in their shoes, as opposed to feeling sorry for them or identifying with them. So empathy and sympathy are 2 different things, and it's really important to develop accurate empathy. And affirmation. You need to believe, truly believe, that you have a stance of hope and optimism for successful behavior change. I know that you can do this. The young person is going to feel more competent, and therefore behavior change is going to be more likely to occur if you can communicate that affirmation, that affirming stance. What about compassion? Well, self-compassion is as important to, as well as feeling compassion for them, you have to feel compassionate for yourself. So not being hard on yourself because you can't make them change. The message I want to get across today is you can't make anybody change. I can't make anybody change. I can't make you learn motivational interviewing. But what I can do is inspire you to think about how you might go about learning more about it. So it's about kindness, not judgment. It's about humanity versus isolation. And it's about being in the moment, being mindful, rather than getting all in your head, as RuPaul likes to say, for those of you who shout out hashtag Drag Race UK. And finally, evocation. What we're doing with motivation interviewing is evoking intrinsic motivation, engaging in behaviors for personal interest, not because you're being told to. Excuse me. So what are the 5 motivational interviewing processes? So here they are. You have to engage the young person, you have to focus with them, you have to evoke change, you have to make plans, and then you get to that maintenance cycle. So let's talk first of all about those 4 first processes. What about engagement? Well, engagement is so important. And we begin this, those of you that might have heard me speak before will have heard me talk about the idea of problem-free talk. We want to invite stories of personal strength, abilities, and resources. Tell me about your friends. What do your friends like about you? How would your mum and dad talk about you? What are the things that you love doing? What do you enjoy? What are your values? What matters to you? Everybody has values. And what are those values? Right now, put in this chat for me as you're listening to me. What are the 3 most important values to you as a healthcare professional that made you join today's presentation? And it's not just the values of the young person, it's the values of their mums, their dads, their brothers, their sisters, and their friends. What matters to your mum? A lot of people talked about parents and parents being over-engaged or under-engaged. When you're having a conversation with a mother and a daughter, or a mother and a son, or a mother and a father, what matters to you? What are your values? What things are important to each of you right now? So people can start to see that we all have shared values. It's very unusual that we don't have many of these values that are in this word cloud right now. And one of the things that you can do to engage young people, this is one technique to try, is to say to them, talk me through a typical day, where you can really listen to all of the things that they have to do. And you start to hear, and then I have to test, and then I have to inject, and then I have to check, and then I have to test, and then I have to count, and then I have to test, and then I have to check. It's an enormous burden, and you can empathize. It sounds like you have to do a lot of thinking about diabetes during the day. So engaging is key. That's the most important thing. If you don't engage, you don't get anywhere. In our psychology team, we have a mantra, which is well begun, half done. So engaging with young people is the most important thing. It's much more important than any goal or target that's been set by anybody. So our next value is focusing, and focusing is about goals, getting to that goal, and it needs to be collaborative. So it needs to be, again, as I've said, so what do you want to think about today, Stephanie? What do you want to think about today, Stephanie's mum? What do you want to achieve? You have to include everybody, and you have to kind of look out for the differences and agree what you're going to focus on first. So Stephanie might want her mum to stop nagging, and mum might want Stephanie to do more blood sugars or more insulin injections. So you need to say, well, it's interesting, you guys have got a similar thing that you want, is you both want to not have to be engaged in this conflict. So, but what will we start with? What will we start with today? The agenda is there's 3 questions that you can ask. What is important to you, and what do you want to be thinking about today? One question, and then just let people talk. You can check in how you're going. does today's conversation fit with your values? Does today's conversation fit with what's important to you? And how will we work on this? Would you prefer me to just work with you, Stephanie, or should we work together as a family so that everything is done in a collaborative way? Evoking is our next principle. Now, evoking takes time. It's brick by brick. It's step by step. Here's a conversation that you might have with somebody. Stephanie, it's really important for you to be independent. So that's a comment on the basis of what she's told us. Now, let's ask her an open question to help develop some discrepancy. I wonder how taking care of your health might fit with this value of being independent. Stephanie might answer, well, when I get sick, I have to rely on other people more. So let's take that further. I wonder how missing your insulin might interfere with this value. The spirit of motivational interviewing is to ask questions and to repeat and to address ambivalence, but not to tell people what to do. So in evoking change, we need to build that intrinsic motivation, we need to address the ambivalence, and we have to build commitment. So how can we do this? Well, we can pluck change talk out of the jaws of ambivalence. And there's a little acronym for this. It's DARN CAT. And the D stands for the desire. Look for statements like, I want to change, I wish I could, I really am motivated, or I would like to be different. And if you hear them, repeat them back. Just repeat them back. So you want to do things differently today. You wish you could do things in a different way. You're motivated to do more injections, but it's difficult. A is the ability to change. Words like I could, I'm able to, it is possible. Reasons to change, things like I don't want to be like this, or I know it's difficult because. Look for need. I need to do something about this. If I want to get my GCSEs, I need to be able to manage my insulin injections on my own. Look for commitment. Look for statements of action. And think about the timings. Think about when it might be possible. We can reinforce change by making reflections, and we can summarize back our conversation with the young person. If you've listened really carefully, really actively listened to what they've said, rather than thinking about what you need to tell them, it's a bit like picking flowers and handing them back as a bouquet. I've heard you say that you want to change. I've heard you say that you're able to do more insulin injections at times and that you don't want to be sick, that you need to do more. I've heard you say that you're committed to doing this and you've got ideas about it, but it's very difficult at the moment. And invite young people to say more. Rather than moving straight on, say, well, is there anything else? Is there anything else? Have I missed anything? Could you tell me more? And then make a plan. Remember, it's their plan. Not too much, not too little, and be prepared to alter the plan. So here's a statement from Stephanie. I have to stop missing my insulin if I don't want to get sick, but I still hate thinking about taking it every day. I might respond, you seem really committed to making this change for your health. And of course, you'll never enjoy taking insulin when you're at school every day. So what ideas do you have that might make it easier? Mum, you've heard how difficult it is but how committed Stephanie is. What ideas do you have that might make it easier? After we hear each person and reflect on the change talk, we summarize the connections between each plan. We address ambivalence that one family member may express. And then we reflect the change talk, we provide affirmations, we review if-then plans, and we express hope and optimism. So let me give you my plan for my consultation with Stephanie. Stephanie, when we started, nobody was sure we could communicate enough to make this work, but you've all been really persistent, trying to think about what Stephanie wants. Now, we've heard Stephanie wants everyone to stop bothering about her insulin at school, but she's agreed that she would try and do a blood sugar with one friend and talk to a teacher if it's high. And this was really important to her value of staying healthy and doing well at school. Mum, you agreed that you would ask Stephanie about her blood sugar and help her decide how much insulin she needs when she gets home. And if she hasn't managed the blood sugar at school, you would simply try the next day. And you've all agreed you would save any concerns for the next time we meet, instead of trying to talk about it in the moment, because you help me understand that when you try and talk about it, you get into a fight. Is there anything else you want to add to this plan? So let's just take a couple of minutes, if that's all right, Fiona, for a couple of questions.
That would be very good. Apologies for me finding the right buttons as well, actually, Deborah. So I think there's been lots and lots of questions, really, and it is about a focus of our community wanting to get the best for their patients, trying to improve life chances and outcomes as best they can. But there being frustration, really, that it can be really challenging to get the young person, despite your best efforts of listening, trying to give advice, for them to get onto the same page and just move them that tiny little bit forward, actually, Deborah. How upset should we be about that? And how long should we keep going, keep going, keep going? Is there any cutoff you would say, stop, it's not working, or would you just keep chipping away?
I'd never give up. I'd never give up, but I would always ask myself, am I at the right stage? Am I working at the right level? So we often think about motivation as being at different stages. Sometimes people talk about not being ready to change, that there's no, people don't want to change.
Mm-hmm.
And if people don't want to change, so again, this is something that I've said in other talks. I sometimes ask kids, do you want to change? And they say no. So my next question is, oh, okay, that's really helpful. Do you want to change? And they might go, well, yes, I want to change. I had one girl who wanted to change. We got 4 wants away from wanting to change. So what we agreed was we would just keep working on each level of want.
Yeah. What
would make you want to change? What would be the things that would have to be different in your life for you to want to change? Yep. So you've got to work at the right level. And I think what we all feel this enormous responsibility to keep young people well and to make them better and to fix them. It's called the righting reflex. We've got, as healthcare professionals, we want to make everything right. We want to make it right. So we've got to give that up. We can't make people change, but what we can do is we can help them want to change, and we can invite them to think about how they might change. There's a really good question but from Iffy, which says, how do you support healthcare professionals to keep them motivated for the long haul in caring and keeping on? It's a good question. The answer is that our psychology team work with our diabetes team to help keep them motivated, to keep motivating young people.
Yeah.
So it's that. And also there's a question from Atrai Gatak.
Yes.
I apologize for my pronunciation of your name. Yeah, that's very hard. I think it's because often there's a communication that parents are supposed to step out and stop, leave it to the young person, but neither of them want that. Often they don't want to step out. So I would often say, he can't take responsibility, or let's ask him, does he feel ready to take responsibility? What help do they want from you? And in conversations with parents and young people, I'll ask kids, what is it that you find helpful that your mum and dad do? What is it that you appreciate about your mum and dad thinking about diabetes?
Yeah.
Again, a story about a young person I worked with who mum was doing absolutely everything, and I said, well, what about when you go to university? Is mum coming to uni with you? And she said no. And I said, well, what are you going to do about diabetes? She said, well, I know how to do it. She said, I just like mum doing it for me at the moment.
Yeah.
So often people know how to do stuff, they just aren't ready to do it.
Yeah.
Is it all right to crack on?
It is. I was going to say, I think you should, just in the time. There's lots of great stuff, but just in time, it would be best if you did, Deborah. Thank you.
I was just going to mention, there's a couple of people that have said, well, there's a lot of information and it's hard to take notes. So the slides are being sent out.
Yes.
But as I've said, it's impossible to learn how to do all of this in the 40 minutes that we've got together. What I would say is, if you're interested in this and you're inspired by this, I can give you a very good reference. There's a new book that's just come out, which is absolutely fabulous, which tells you about motivational interviewing. But if you want to know how to do it, you have to go and train. You have to do a minimum of a couple of days training where you practice and everything like that.
Yeah.
Okay, so shall we continue? I want to make sure we get to the end. So our third learning objective was about empowering young people to understand and act on their data. And that's always a tricky one, but what I would say is, your job is not to take responsibility for change, but to support and guide. Your role is to elicit the young person's own ideas for change, even if there's a constrained environment. So you might say something like, your parents say you've got certain chores to complete, but maybe you can decide the best time of day to complete them. So it's about, where is the negotiating? Where can you negotiate? So you provide this environment of supportive autonomy, of eliciting their perspectives by giving information and a menu of options and emphasizing their personal choice. So if you're clarifying your role as a guide, here's a statement that you might make. You might say, I'm not here to tell you what to change or how to change or what your parents think should happen, but rather to find out what's going on in your life and help you make the changes you decide to make. You try and avoid not saying you and yours. So try and say, rather than saying you feel confused about why you're here, you might say young people often feel confused, or you feel angry. Don't say you feel angry about why you're here. You might say young people often feel angry about why they have to come to clinic. And you avoid the problem and you name the behavior. So you're here to talk about managing your diabetes, not you're here because you're not managing. So it's a non-judgmental statement. And when we're emphasizing personal choice, we say things like, yes, you're right, no one can force you to take your insulin. If you're not ready to talk about this, well, let's focus on something else. And instead of saying, we will figure this out together, say, I can support you to figure this out. Instead of saying our first step, or the first step is, you want your first step to be. What about giving information? The dreaded test results. Well, you ask permission. Is it okay if we talk about your test results? Somebody with asthma, are you interested in finding out more about how smoking affects asthma? How much do you know about ways to remember taking insulin? And what you do is you chunk. You say, what do you think about that bit of information? Give them another chunk. What do you think about that information? So you ask them, you tell them something. You ask them, you tell them something. So you ask, tell, ask. Now, again, this is quite a lot of information, and again, there's a lot more detail in a very good book that I will recommend. But when you're faced with that resistance, you have to do 3 things. You have to stop, drop, and roll. So the first thing is, if you're noticing that somebody's looking at their phone or not really engaging with you, say to yourself, what am I doing to fan the fire of resistance? And it might be, oops, I just told her she had to inject. You drop, and you drop by saying things like, you are feeling frustrated. Well, you still decided to come here today. I'm sorry you feel angry about coming here. And then you roll. On the one hand, you don't want to be here, but actually it's important to you to get good GCSEs. Listen, you can decide how to use the time we have together. What do you think needs to change for things to be better? Now, this might feel terrifying because you might be thinking, oh, I won't get any response. You do get responses. When you start to use these approaches, young people respond. You can also do things like invite people to talk about the pros and the cons of change. Where are they? How are they changing? What are the changes that are advantages to taking more insulin, advantages to doing more blood sugars? What are the negatives? And I've got 12 top tips here that you will get when you get the slide set. I sound like a QVC advert here. When you buy our webinar, you will get this free set of 12 top tips. So here they are. Clarify your role as a guide. Offer you statements which emphasize personal choice and control. Promote personal responsibility by emphasizing values, goals, and plans. Elicit the consequences of decisions and actions. So what will happen if you do that? What will happen if you do this? And use ask and tell and ask to provide information. Let's look at your Is it okay if we look at your download together? Don't say, let's look. Is it okay if we look at your download together? And use a menu of options when discussing plans. But don't. Well, if you do the don'ts, then you won't get any engagement. Don't present as the expert. Don't try and convince and persuade. Don't say we should do this. It's not we, it's them. They're the one who's doing it. You've had an hour, you've had a 20-minute consult or an hour consult. It's not you, it's not we, it's them. Don't miss opportunities for discussion of values. What matters to you, what's important, and don't provide the consequences. Of course you know them. You're the healthcare professional. You've done all the training, you know it. It's them that have to realize it. Don't give them loads and loads and loads of information in one go, and don't avoid information feedback opportunities, particularly if a young person asks for it. Okay, 2 or 3 questions on that. A lot of info, but it'd be lovely to read some of your comments and thoughts. Oh, Shilpa, I was just going to say that's a great question from Shilpa. How do you think I can help? Yeah, brilliant question.
Yeah, there's been lots of, I think, sharing with you about, well, there's been mention actually, Deborah, about the time constraints that we're all under when we actually consult. Yeah. And as you know, the MDT is on a sort of 30-minute restricted time scale. Would you advise us to start on the conversation during one of these 30 minutes and then potentially pick it up the next time? Or how would you, when they start opening up and it's 25 minutes with 5 minutes to go, what's your advice to the MDT at that point?
Yeah, it's a good question. So the whole point about motivational interviewing, and I apologize, I've got two monitors on the go here. So that was the slides for the drop, stop, drop and roll, pros and cons. And those are the 12 top tips, which I'll leave up there for the moment. Yeah, I mean, if you're using this model, you can have a bit of structure. So the structure is to start off by asking people, what do they want to think about today, and giving them sort of like 5 minutes to think about telling you what they want to think about. Yeah. What do you want to focus on? What do you want to achieve? So set a goal, give them about 5 minutes to really think about that. Okay, well, we've got 10 minutes to think about that goal and ask some of these questions. You know, what are your ideas? What have you done in the past? What could you do? What are your thoughts? And you can listen to them. The less you talk, the more time they have in the consult. That's the other thing. So you let them talk and you just listen. And even if they stop talking, you can say nothing.
Yeah.
Just anything else, take a breath. And then 5 minutes before the end, you say, okay, listen, we're going to have to stop today, but let's think about what options you've come up with. So make your plan in the 5 minutes that you've got towards the end, and say, how about we pick this up the next time we meet and see and hope and optimism, and let's hear what's going well.
Yeah, no, so that's really good advice. And I wanted to pick up an important question, I think, or a comment really from Samir, who said, all advice you're giving, Deborah, is great. Is there any means of testing the outcomes of the practice that you're suggesting? When do you expect to see positive outcome, and how do you assess it? Is it just an A1C, or what about assessing quality of life?
The answer is, so the quick answer is both and. There's a paper by myself and Shannon, which gives some of the data for outcomes when you use this approach. And again, happy to share the link for that paper, which, if people haven't read it, but it's a summary, a review of a lot of the evidence on motivational interviewing. There's a massive research evidence base out there now. 10 years ago, there were probably about 2 or 3 papers out. Now there are hundreds showing that this has an impact both on HbA1c and on quality of life. And sometimes, I suppose, as a healthcare professional, you might have to compromise. You might not get quite the HbA1c you'd quite like, but you might see a massive improvement in quality of life. And as that quality of life improves, the HbA1c may follow it. So it is about patience.
Yeah. And just a comment really from myself. I mean, we spend lots of time with a 10%, should I say, of our cohort that really, we don't seem to be able to shift at all. And there's ways to give our healthcare professionals a way of just backing off slightly, not giving up. That isn't the word, but backing off so that they don't use all their time and effort with a very small number of patients that aren't quite ready to move on. Would you have advice for us about that?
I would say keep them engaged. And just keep working on your spirit. Keep working on your spirit. And if you have the motivational spirit, it changes your burnout levels. Because if you do have hope and optimism, and you believe and you have good empathy and good compassion, then you don't feel bad about the fact that you can't change somebody. So I would go back to those, go back to spirit, and go back to the pace, if you like. That remembering that you can only do so much, and you have to be kind to yourself as well as kind to the young person that you're working with.
And Anelia had a comment there about, the good cop and the bad cop type of thing, and the parents always wanting the diabetes team to sort of be, sort of the ones that tell them that they won't listen to the parents, so it has to come from the diabetes team. How do you feel about that?
What I would say is that we haven't got time to go over that in today's workshop, but if you read the reference book that I'm going to tell you about, that explains, you have to get parents on board. You have to explain the principles to them. You have to get the parents understanding motivational spirit.
Very good. Thank you. Do you want to just move into the final part?
Sure. So we're coming up towards the end. And we're talking about peer support. I just wanted to very, very briefly share with you some of the ideas that we use at UCLH. So we use the Tree of Life, which is a creative way of working with young people to invite stories of their history, values, skills, and abilities, so that you really work on engaging young people without diabetes being the core. This just shows you here some pictures of trees that young people have put together.
Deborah, it's not moving on. Have you got
Oh,
a
okay,
slide?
sorry, it's me.
I'm
pressing the wrong button.
Thank you. That's
there we
excellent.
go. Thanks, Fiona. So here we've got, where are we? So there's a forest. There's a forest of trees that young people have all put together in the morning session, and in the afternoon they talk about the storms of diabetes and how the storms can make the trees blow a bit, but if you've got good roots and a good trunk and solid ground, that you can weather those storms. This is our Getting Ready for Transition group, which is another similar approach that we use to connect young people. And we do all these groups as online groups now, working with young people. And I wanted to just give you some, I'm not going to say anything. I'm just going to go through these slides now, which just show you the sort of outcomes that we get when we use our peer support groups. So managing health conditions, helping with emotions, realizing strengths and identity, giving people space to talk, social connectedness, communication and relationships. Oops, sorry. And was the final one. So coming to the end, change is a journey that one travels throughout the lifespan. So questions about how long do you keep going? Well, you keep going as long as they're coming to you and you keep working with them. And you have to remember 2 steps forward and 1 step back is really prevails. You have to constantly review, you have to constantly respond to difficulty with empathy and non-judgment. And don't see it as relapse, don't see it as failure, but it's little setbacks, it's slips and it's hiccups. So you have to hold on to that hope and optimism.
So thank you once again, Deborah. Thank you, Fiona, and thank you all for attending. I hope you enjoy the rest of your afternoon. Thank you. Bye.